What do you think about weight loss drugs? That is one of the questions I was asked this last week by one of my patients, so I thought this would be a good video to make. So welcome back to the Physician Gardener. I am your Physician Gardener, Dr. Kashidi Long. I am board certified in internal medicine and lifestyle medicine. So there are several medications currently on the market approved for weight loss. That would include Wegovy, Saxenda, Contrave, Qsymia, Phentermine, Ally, and these medications can be effective for some people. And so today we're going to do a brief overview of each of the medications, and then I'll give a summary at the end of what I think of weight loss medications as a whole. So Phentermine is a stimulant and appetite suppressant. It is very common, has been used by a lot of weight loss clinics over the years because it is effective while you're on it. It can help people lose maybe 5% of their body weight, or at least we consider a good response to be a 5% weight loss over the course of 3 months. So if you are 200 pounds and you lose 10 pounds on Phentermine, then we consider that a pretty good amount of weight loss. The possible side effects, or the most common side effects, or the ones you should look out for, jitteriness, anxiety or anxiousness, heart racing, increases in your blood pressure, insomnia, things like that. So if those are the things that can generally cause people to need to stop Phentermine. So if you have high blood pressure and your blood pressure goes up on Phentermine, obviously you need to stop it because it's more important that your blood pressure is controlled. If you have high blood pressure, Phentermine might not be the best option for you, or if you have high blood pressure that's not controlled, actually. Because if your blood pressure is controlled, then the Phentermine might still work for you. The next medicine I mentioned was Ally. Ally is also known as orlistat. The brand Ally is actually sold over the counter and you do not need a prescription for it. There is a higher dose that can be written as a prescription. I think the over the counter one is 30 milligrams and or is it 40? The over the counter one is 30 or 40 milligrams. The prescription one, I believe, is 60 milligrams. Scratch that. I don't remember the milligrams of Ally off the top of my head. However, Ally works as a fat blocker, so you eat it before each meal and then it decreases your absorption of fat. And so the common side effects for that are going to be bloating, gas, loose stools, or diarrhea. And so for that reason, Ally may not be tolerated well by some people. But it is one of the ones that is considered first line because it has, I guess, the least number of potential severe side effects. Another one is, let's see, we did Phentermine, we did Ally. Contrave. Contrave is bupropion and naltrexone. And bupropion is also known as Wellbutrin. The complete mechanism of Contrave isn't completely defined, but we think it helps with the neurotransmitters that relate to food addiction and food cravings. And so basically, it decreases how much you are eating. It can have, because it has bupropion in it, which is a antidepressant, it can have some of the side effects that you would have if you were taking it for antidepressant reasons. The amount of bupropion that's in Contrave is lower than the usual therapeutic dose of what it would be if you were taking it for anxiety or depression. So in theory, it is less likely, but there is still the potential that you could have increased or a sudden depressed mood, or increased anxiety, headaches, sleep troubles, mood changes, etc. And so you would have to monitor yourself for that. I think the naltrexone aspect of the medication can cause more GI side effects. I have also never actually seen anybody's insurance cover Contrave. The next medication I want to mention is Qsymia. Qsymia is a combination of Phentermine, which I mentioned earlier, and Topamax or topiramate. Topiramate is an a medicine that is sometimes used for seizures and migraines. And so the exact mechanism of how that helps with weight loss is probably not fully fleshed out, but it does. So the phentermine plus the Topamax have a better amount of weight loss than phentermine alone. The side effects would be the same as the individual drugs. So the potential side effects or cusamia are going to be the same side effects as phentermine individually and Topamax individually. Once again, this drug will help you achieve, I think it's about 3 to 7% weight loss. Now on to the big dogs, Saxenda and Wegovy. These are your GLP-1 agonists that are all over the place right now. The other names for these medications, Saxenda is also known as Victoza, and then or liraglutide, and then Wegovy is also known as Ozempic, also known as semaglutide. And I'm not on TikTok, but I do believe that these medications blew up off TikTok because somebody famous said that they used it to lose weight, and then everybody now wants these drugs. So Saxenda is a daily injection. Wegovy is a weekly injection. They act by slowing down your gut motility so that you feel hungry, or no, they act by slowing down your gut motility so that you feel full faster, which leads to you feeling less hungry. They act on either your leptin or your ghrelin to tell your brain that you are full faster. Because your gut motility is slower and your brain is telling you you're not as full, you eat less, therefore you lose weight. Now, if you have a family history of MEN2 syndrome, you should not be taking these medications. If you have a family history of medullary thyroid cancer, you should not be taking these medications. If you have a personal history of pancreatitis, I would not recommend, because there is an increased chance of pancreatitis in patients who take GLP-1s. The most common side effects are going to be constipation, because it's slowing down your gut. That can be alleviated with increasing your fiber intake, increasing your water intake. However, some people, instead of constipation, will have diarrhea, which, how does that make sense? I'm not really sure. You can also have nausea, vomiting, bloating, upset stomach / bubble guts. Usually if you eat smaller meals, that will alleviate a lot of these symptoms, but some people just absolutely cannot tolerate these medications. That is the brief overview of all the meds. Of course, there are more side effects. I could not list them all. Any drug or medication that you take has the potential for side effects. There is a long list of side effects on all the package inserts, so you can read that for more information or go on the medication's website and review the information on there. Every medication has a insert with potential adverse reactions. Anything that happened to somebody during the trial is listed there. So overall, what do I think of weight loss medications? I think that there is a time and a place for these medications. Obesity is very complicated because as you lose weight, your basal metabolic rate adjusts. As you lose weight, a lot of people will hit a plateau, or even before losing weight, getting the motivation to lose weight or being consistent is very hard. We also have food deserts that complicate this. We have all these external stimuli coming in, from the commercials on TV to the billboards to the fast food being on every corner, that make losing weight very difficult. Even in people who think they eat pretty healthy, like some of the things that have been sold to us as healthy foods are not as healthy as we think. So it's not all just calories in, calories out, because not all calories are equal. Like, what am I trying to say? 250 calories from a soda is different from 250 calories worth of apples. Your body will metabolize that differently because of the fiber content in the apple and the lack of fiber content in the soda. Your body's not going to process those the same. So the number of calories that you actually absorb is different. All that to say, obesity is complicated. And so I'm not opposed to people taking weight loss medications. I'm not opposed to prescribing them. I have prescribed them to people in the past with a lot of success. The caveat, though, is that if you have a metabolic disturbance that is the reason for your obesity, and you take a medication and it helps you lose the weight and you get down to your ideal weight, you probably are going to have to stay on the medication lifelong to maintain that weight loss. If you are a person who doesn't have a metabolic disturbance and you take the medication, you don't change what you're eating, and you lose weight, as soon as you stop the medication, you're going to gain the weight back. So I always counsel on lifestyle modifications in addition to medication. And once you have gotten your lifestyle optimized, then tapering off the medication to see if you are someone who can tolerate going off of it. Not everybody's willing to do that or is interested in that plan. So it really varies from person to person. Um, let's see. What else? Oh, the other issue with some of these weight loss drugs is, number one, a lot of insurances do not cover weight loss medication. So while your insurance may cover Ozempic because it's for diabetes, they will not cover Wegovy for weight loss. And then if all the people who are wanting Wegovy are being prescribed Ozempic, then you wind up in the mess that's been going on for the last year, where there's been a shortage on Ozempic or it's on back order every other week. It's been pretty ridiculous. And so, if you're a person who doesn't have their lifestyle changes under control and your medication goes on back order, how much weight are you going to gain while you're waiting for that medication to come back into stock? And so, I don't like the use of weight loss drugs if you are not doing complementary measures to keep your weight down in the event that you can't take the medicine for some reason, because then it's kind of like you doing a yo yo diet and going back and forth really isn't good for anybody. Let's see, what are my other thoughts? So, in conclusion, weight loss medications do have a role in obesity management, and I am not opposed to prescribing them, but I think you should be very informed about potential side effects, and you should also be working on other things in your life that are contributing to your obesity, as opposed to just trying to take a medication as like a magic cure. Let me know in the comments what your thoughts are, if you have any questions. If you like this video, please share and subscribe, and then watch another video. I'm the Physician Gardener, and I will talk to you again soon.